Care Partnership of Suffolk and North East Essex. This meeting, of course, should have happened on the 9th of September, but the day before Her Majesty Queen Elizabeth died, and it was the right thing to do to determine that that meeting should be cancelled. I think all of us will have personal and more distant memories of Her Majesty. I had the great privilege of being her treasurer for her Diamond Jubilee Trust and worked to her for several years, experiencing at first hand that extraordinary sense of detailed care for people, interest in people, sprinkled with a sense of humour. So we all mourn Her Majesty, and we understand why it was the right thing to do to cancel on that day. Therefore, today we are having this meeting, which was not scheduled, but where we are going to cover the business that was going to be done then, and we will move with pace in order that Will Pope can take over for the second part, with the workshop covering two extremely important areas around equality and diversity and around cost of living in a more informal workshop session for members. For this formal part of the meeting, there are members of the public joining us on live stream. You're very welcome. I will give you the opportunity at the end of the meeting to ask any questions that you feel really need to be asked in this forum. Alternatively, we will supply you with an email address to ask questions. You will appreciate that depending on what the question is, we may not be able to give you the answer today, but the opportunity for asking will be there. I'm going to pass over to Susanna to give the apologies and deputies.
Okay, so good morning, everybody. So I've received apologies with deputies from Sharon Alexander, who is being represented today by Lisa Andrews, Penny Casson, who's being represented by Ganesh Balia, Lucy Whiteman from Essex County Council, who's been represented by Danny Scholl, and from Prima Fairburn from the Suffolk Association of Independent Care Providers, who's being represented by Hilary Gibbs. Alan Cadzo, Anthony Douglas, Marcus Bailey and Tom Norfolk have also all sent apologies. We are welcoming attendees, 3 attendees this meeting from our Voluntary and Community Sector Forum, Nikki Wilshire and Carol Eagles from the Citizens Advice Bureau, and Kirsten Alderson from Suffolk Family Carers. And then joining the Integrated Care Partnership today for the first time are Ian Gallen, representing the District and Borough Councils in Suffolk, Nicola Cottington from West Suffolk Foundation Trust, Tanya Farrow from the Suffolk Local Pharmaceutical Committee, and Melanie Craig from Suffolk Community Foundation.
Okay, you're all very welcome. To everybody who's here for the first time, whether as full member or deputy, you're equally welcome. Declarations of interest. Now, this is an agenda where I don't think there will be, but the point about it is, for future reference, declarations of interest, we will always take permanent declarations of interest as understood. That's, for instance, if one is employed by the ICS or in some way, that will be an understood interest, which we don't need to declare any time. What we are looking for is where the agenda creates a specific declaration of interest need. Are there any such specific declarations? Is that minutes next?
Can't see any. Can't see any hands raised, John.
No, I see no hands raised, so we will assume there are no declarations of interest. I think we now come to some tidying up, Susanna, don't we?
We do indeed.
We have some minutes that were left over from the old integrated care system meetings and some actions which we just want to absorb and take forward. I'll ask Susanna to explain how these will be picked up in the workbook that has been created for the ICP.
Okay, so essentially we're just asking members of the ICP to formally receive the final minutes and action log from the Integrated Care System Board, who of course met for the final time in June 2022. And also the minutes from the first meeting of the Integrated Care Partnership that took place at our Expo event on the 1st of July 2022. What we've done is to go through the actions from both of those meetings, and those now have formed the action logs that you'll see in a new product, which is an ICP workbook. Now, this is a document with, if you have a look, it's in Excel, it's got different tabs along the bottom. And basically, it's going to be a rolling workbook where we can keep in one place the log of attendance at meetings, the actions that we agree, and the bring forward agenda for the ICP as well. You'll also see that in some of the later tabs in the workbook, you can see dates and arrangements for ICP meetings, and also some of the dates for other linked forums as well. So we're building up something with a little bit of a system diary in that document as well. So I hope that's going to be a useful resource for you in terms of keeping track of the work that we do together as a partnership going forward, and a reference for you between meetings if you're looking for that type of information.
Thank you, Susanna. Are there any questions before I ask you to approve these various sets of items en bloc?
Can't see any hands raised.
There are no hands raised, so I'll take agreement unless anybody shouts to the contrary. Silence will mean assent. Okay, thank you very much. I'll now pass over to Will Pope, who's going to give us a report back from the Integrated Care Board. Now, just for the aid of those who are struggling a bit with all these pieces, the Integrated Care Board is where the major decision-making responsibilities for this system sit, and where there are budget items and so on to be resolved, dealing with many of the NHS items, but as well as being the approval point for items of strategic import as well as operations. So, Will, can I pass over to you to give us an update, particularly on the meeting of the 27th of September?
Yeah, thank you very much, John, and thank you for the introduction as well. So in the pack that you have, colleagues, you've got the minutes of the 26th of July, which actually have been approved by the subsequent ICB board meeting. I'm going to take those as read and just ask for any questions if there are any, and then I'll give you some highlights on the subsequent meeting. So I'm taking as read, don't see any hands raised, in which case then I will move on to the subsequent meeting, which was only a couple of weeks ago, 27th of September. And these minutes, of course, as you'll appreciate, are unapproved at the moment. It won't be approved until they go to the next ICB meeting. It was very much a processy meeting in many ways, and I'm only going to give you the highlights. I'm not going to go through the whole 3-hour meeting, as I'm sure you don't want me to. But it was the first, if you like, formal, proper meeting post setup of the ICB. But whilst it was processy, and had to, process things like terms of reference and so on, which I won't go into. It had a number of really interesting items from a system perspective, and one item which I will end with in my summary here, which I think was particularly exciting and about which the ICB board itself got very excited, and this was an item around the wider determinants of health, job creation and economic growth and all that aspect of work, which is so important to us. In fact, it was really interesting from my perspective that actually the item was so well received. It was presented by some guests with experience of the item that the board actually gave a round of applause at the end of the item for the presenters and their content. And I have to say, I think that was a spontaneous round of applause, which is actually quite unusual at boards, isn't it? But anyway, I'll finish with that. I've picked out half a dozen things, I think, which might be of interest to us all. The first was around non-executive member capacity, and what the board and colleagues have now realised is that we, as an integrated care board in Suffolk and North East Essex, have only, in inverted commas, only appointed 3 non-executive members. And in actual fact, the importance here, as you'll appreciate, is that independent advice, challenge and critical friend approach in the lay member approach. we've only appointed 3 following regional guidance, whereas in actual fact, we now know, as other ICBs are established and reporting up and down the country, that actually many, very many, have appointed 5, and very, very many have appointed 4. And the reason being, as we are now starting to feel the capacity challenge there. So we discussed that capacity challenge, and I think it's highly likely it'll come to a future board meeting, but we will be looking for additional non-executive lay member support. So expect more on that, I think. We also talked about North East Essex super diabetes performance and how that could be rolled out across the system, and our ambition there, so to do it, was explored with great enthusiasm. We talked about dentistry, which of course is a very apposite subject at the moment, very much a work in progress, and we'll come to, there is a lot of work in progress on that, and that will come to a future meeting to check that progress. We referenced the Newmarket CDC and the £15 million investment in that, about which you will now know because it's public, and that the approval of that was very, very well received and should be open from 2024. Population health management strategy and intelligence function were debated at length. I won't go into those because, of course, they're on today's agenda. So I'll simply leave it there with the comment that the ICB is very, very supportive of this approach. We then talked about general board capacity, wider board capacity, and particularly diversity and EDI. But again, it's on our post-formal meeting agenda today, so I won't go into it in more detail other than to say that it's great that it's on the workshop for later this morning, and indeed it is the subject of the next ICB development session. So I'll simply then close with the final item, which was around the Community Diagnostic Training Academy, which is an ESNEFT and Colchester Institute joint initiative, which is really, really exciting, both in its impact and potential future impacts if we are able to roll this out across the system. So the CDTA, the Community Diagnostic Training Academy, was a project that was started in November 2021 with community renewal funding. And the initial idea, well, the idea is to support employment and skills development in tendering. And the initial idea was to support unemployed people into entry-level roles in the new community diagnostic centre at Clacton Hospital. Now, about 50% of the participants were unemployed when commencing the project, and 80% were resident in tendering. And we've so far had 169 participants in the programme, of whom 40 have already secured employment and a further 22 are progressing into further education or training. And the remainder are either still in the programme of work or have completed it and are now job seeking elsewhere. So we're really excited about this this project and the prospect, the possibility, not only for having a workforce impact, but for having an individual impact in terms of employment and the wider determinants of health, recognising, of course, that employment is the biggest influencer in the in positive wider determinants. This actually also came to the chairs group on Wednesday of this week, and the chairs group have asked for a specific presentation on this item, the idea being then that we try and accelerate, roll out and widen this initiative across the system using anchor organisations, resources, and with the positive influence and support of our chairs and lay members. John, I think that's my summary, but I'm very happy to take any questions.
Thank you. Well, I'm going to take the privilege of being in the chair to ask you two questions myself. I'll give you them both together. In terms of the non-executive directors, I'm intrigued to understand how they pick up the understanding and the feelings and the knowledge of what goes on in this partnership when they're not members. And they don't need to be members to have an expectation of either attendance or visibility. So I appreciate they're non-executive members of the Integrated Care Board, but I just would think it would be helpful if they had visibility and audibility of what's going on in the system. And secondly, Will, in terms of, I've seen the minutes for the September meeting, ladies and gentlemen. They're 13 pages long. You would not want to, want to go through them. Do you think we could start soon after the ICB meetings, having just a summary of key points, actually of the sort of length of the note you've given us from the July meeting, so that people can be appraised of key decisions or actions or whatever?
Thank you, John. I'm very happy to take both those points forward and implement as best I can.
That was very good, thank you. Other questions or points from members around the room, this virtual room?
Can't see any hands raised.
We're not seeing any hands. If anybody's hand is not being seen, can you shout?
No shouting.
No. Okay. Thank you very much, Bill. That was very interesting, and the work about that employment area, so critical. I have quite a lot I can say in the areas of diversity. We come now then to us to receive the news of the appointment of the new chair of the Voluntary Community and Social Enterprise Assembly for the Suffolk and North East Essex Integrated Care System. And I said all of that without pausing for breath or taking a comma. I'll hand over to Christine Abrahams.
Thank you, Chair. I think that's why we call ourselves the VCSE, because we lose breath too when you say it all in one go. So I'm Christine Abraham. I'm Chief Exec of Community Action Suffolk, with the infrastructure organisation working across the county. And along with 11 VCSE colleagues, we've been working as a VCSE design panel for around 2 years now. The design panel's led on various aspects of work and priorities. The first one was about establishing the VCSE as an equal partner within the ICS, and we've made significant progress on that particular area. But we've had initial work and engagement and a draft of a VCSE resilience charter for the system. We've done work around VCSE workforce, and of course through the pandemic, the VCSE through the design panel were very much involved in COVID and the vaccination. But longer term, the design panel had an aspiration or a vision priority to develop a VCSE assembly, which would enable would enable the VCSE to be integrated into the new structures at system, at place and at locality. That's no mean feat with the diversity and reach of the VCSE sector, which is also actually a strength we have too, although it creates us a challenge. But we identified as a design panel that we would need a special individual with skills, knowledge, expertise, and an ability to build and maintain and strengthen relationships across the wider system. And I'm delighted to announce that we have appointed Kirsten Alderson in the role of chair of the VCSE Assembly. Some people on this call might already know Kirsten from her role with Suffolk Family Carers, and I believe Kirsten is on the call today. So I'm sure that members of the ICP will join me in welcoming and congratulating Kirsten to this exciting new role for the sector. Thank you, Chair.
Thank you, Christine. And Kirsten, I hope you feel the sense of congratulation rather than trepidation. It would be lovely if you'd just like to say a few words, Kirsten, so that people who don't know you get to know your voice and your face a bit. So, Kirsten.
Thank you very much, Chair. And thank you, Christine. I'm absolutely delighted to have been appointed to this role, and even more delighted that you called me special, and I hope that continues. So I've been working in the Suffolk system in the VCSE for about 10 years. 8 of those I've been CEO of Suffolk Family Carers. And I've always tried to promote the voluntary sector across the system, in terms of partnership working across the system, but also, just in itself as a really important key part of the system. So I'm absolutely delighted to have been appointed. I'm really looking forward to getting started and very much looking forward to working with you all going forward. So thank you very much.
And very best wishes in your new role. I'm going to hand over now to Suzanne Howard, who's going to update us on the work going on around the integrated care system strategy, a piece that's very important to us all. So Susanna, you might just want to vary the agenda a bit, because you might, in doing this, also explain the arrangements for the next meeting, because that would flow together, wouldn't it?
It may well do indeed. Thank you, Chair. So I've sent an update paper, so you should have a paper in front of you, but I'm also going to ask my colleague Kathy to just share screens so that you have sight of a page on our ICS website, which has some details on there about some of the work underway at the moment. So as I refer to these things, I think Kathy's going to scroll down that. So the paper that I've sent you builds on an earlier paper that I circulated for the meeting that obviously didn't take place in September 2022, but it outlined plans for the development of our integrated care strategy for Suffolk and North East Essex. The Department of Health and Social Care requires us to have at least an initial integrated care strategy in place by the end of December this year. And that's important because this strategy will be a key driver for the development of the joint forward plan for the NHS Suffolk and North East Essex joint forward plan that my colleague Richard Watson is leading on, but also other planning in the system as well. So it's really important that we at least have an interim strategy in place by the end of the year. But what's going to be slightly different about this to perhaps other strategies and plans that we've done in the past is that after that point, we will and should continue to evolve and further refine and develop that strategy on an ongoing basis. So this will not be a document. It won't be a single document that we'll polish and refine and print thousands of copies of. What we will be doing instead is pulling together and putting in one place our collective strategy as an integrated care system as an online resource that all of us can use to better align and integrate the work that we do together. So we really want to involve everybody in the development of the strategy, and that's no mean feat when you look at the diversity of partners in our integrated care system. We've agreed that the development of our strategy should be based on a clear methodology around outcome-based accountability. And on that basis, our strategy will focus around 2 key questions. So the first is, what matters to you and why? Is that start with why question. And the second is about how we should be thinking differently together in health and care. So what you'll see on the web page that Kathy's scrolling through is that we've established a range of mechanisms through which people can engage with the development of the strategy. So firstly, directly, there is a link there. You'll see a little QR code and some links to some means for people to provide direct feedback if that suits. I'm incredibly grateful to both Healthwatch Essex and Healthwatch Suffolk, who are supporting the engagement around the strategy by setting up kind of independent engagement around those questions. So, for example, in the paper, you'll see a link to a really fantastic set of resources on the Healthwatch Suffolk website which offer opportunities for the public to engage. And similarly, Healthwatch Essex are setting up something very similar. And then also we're working with colleagues across wider public and patient engagement mechanisms across the system to ask them to do 2 things really. Alongside Healthwatch, if you like, share with us any existing engagement that has been undertaken. Of course, we want to incorporate where we've done work already, where people have shared their experiences and their views with us, but also to build, if you like, this engagement into other work that they're doing as well. Then, in addition, if you scroll down a little bit further, you'll see that we have now set up some dates for some specific workshops, which are intended to ensure that we spend time as a system focusing on the specific perspective of key groups. So we held the first of these yesterday, which was a workshop focusing on the experience of people living with cancer. So that was very well attended yesterday afternoon, and it was attended by members of people with lived experience. We had clinical colleagues there, and we also had colleagues who are leading from various aspects, planning and strategy and delivery across the system as well. So those are really key opportunities. You'll see there's a range of dates there for those events going forward, and we've got another one next week, and then there'll be a little bit of a pause, and then a run of them during November and early December as well. All of the agendas, and there are links there. In actual fact, you can literally click the link there to join the meetings that are listed. Then if you just scroll down a little bit further, we've also we have our infamous ICS pop-up video booth on tour now around the system. So on Friday, we were at the social care conference at Worsted Park, which was a great opportunity to engage with social care providers from across Suffolk. And then you'll see there a whole range of different locations where our pop-up video booth is going to be an opportunity for people to literally speak and to us as health and care leaders. And then also a little bit further down, the other opportunity is that we've got a small amount of money to support organisations who can hold a community conversation. So we have a number of community conversations there that you'll see have already been set up. We'd like to have some more. So, for example, in libraries, some of the friendship and dementia cafes, with particular groups. So, for example, African families in the UK, you'll see at the top there, and so on as well. So those are also opportunities for people to feed into the work that we're doing. So in terms of the strategy workshops, the one final one that I'll mention is that we've been having some conversations. We did a workshop as an ICP looking at some work from Dr. Will Bird, who has raised, and there's a lot of interest in the system around the concepts around belonging, safety and purpose. In actual fact, as an update to my paper, in actual fact, we've looked at this, and people were worried about being able to make 3 different workshops. So we're actually going to consolidate that into one Thinking Differently Together event around belonging, safety and purpose, and we'll update the date for that. So that's where we are. The next big challenge is going to be, of course, analysis of all of that content received. And what we're going to be doing, looking through that feedback, is really looking for the components that make up that outcome-based approach to setting out our strategy. So where people identify benefits or outcomes that we can articulate as I statements, the stories that we can use to show and deepen our understanding around the key issues highlighted, where we can look at potential ways and indicators that we should be considering in terms of evidencing our impact, our collective impact, and also articulation of how and where we should be thinking differently together as a collective health and care community. One of the benefits of developing our strategy as an online resource is that it means that, of course, once we have a draft, it's fairly easy to give people access to that draft, because we can share a link and people can start to see it as it builds up. So this gives us the building blocks, but once we start to put those together, there's an opportunity to shape and refine that still further. So finally, we're at an early stage. We have until the end of the year to pull this work together. But looking ahead to November and the important role, obviously, for all of you in helping to shape the strategy, we're proposing to turn over our next meeting of the ICP, which will be a meeting in person. And it will be hosted by the Ipswich and East Suffolk Alliance as part of a local community event called Community Connect, which will be taking place at the Food Museum in Stowmarket. So given the fantastic opportunity we've got to actually be in a room together, what we want to do is to use that opportunity to start to look at some of that evidence and that voice coming back from the engagement with people, and start to focus on really then what that means in terms of the priorities that we should be considering for our strategy. So our steering group have been discussing the business about how we articulate priorities and the evidence behind that, and that might be something that members want to comment on this morning. You know, what principles should we set priorities for our strategy? But we're looking ahead to doing that work together and starting to dig into the content that we've drawn on the 11th of November. So the recommendation or the request of members of the ICP this morning is obviously to note the report and the plans, but please do support all of the activities you can see there. Please encourage your colleagues, people through your networks to engage in the development of the strategy. It is a very busy time at the moment. There's a lot of draws on people's time, but you can see there that there are specific angles on the strategy, many of which I know individuals will feel passionately about. So please do encourage people to engage in this. It's important work, and it will be important in driving the system forward on an ongoing basis. Thank you very much.
Susanna, that was very thorough. Thank you. Are there questions of Susanna on that presentation?
So we've got Ed and then Nikki.
Ed Garrett.
Thank you, Chair. Morning, everyone. Excellent work, Susanna. The last thing I want to do is ask you to do more work, but I was thinking about the cost of living conversation we're going to have later this morning, and whether we should be organising some sort of workshop with both the public and maybe staff around cost of living and the impact that's having on health, and obviously decisions that people are making around employment too. Just an idea to think about.
Could suggest, Ed, that the time to make a decision on that's after this morning's session, maybe. I think from my perspective at the chair, the criticality of demonstrating the ability to offer additionality. I'm certainly aware that in Essex there's already a cost of living summit to which all members of the Integrated Care Partnership from Essex will be invited. If you see what I mean, Ed, I think it's a great idea. Let's make a decision on that if Will Pope's happy after this morning's session.
Thank you.
Who was the next point?
Nikki O'Shaughnessy. Nikki O'Shaughnessy.
Nikki O'Shaughnessy.
Hello, thank you, Susanna. I just wanted to ask, in the spirit of co-design and co-production, do we think we have enough platforms to capture the voices of children and young people as we work through this consultation?
Thank you very much, Nikki. I think you raised a really good point. It was a point actually we discussed at the steering group this week. So one of the things we're looking at the moment are opportunities. I think the pop-up video booth might be popular actually, because you don't need to write something. You can literally just talk to that as well. So we're looking for an opportunity to take that out. But absolutely, I completely agree. And if there are, looking around the partnership, if you have access to a group, if you're able to perhaps support us around a community conversation or engagement, we'd be really, really happy to support that with any of the mechanisms we've got available. So thank you very much. And yes, if offers, please.
Thank you very much. Are there any other hands up?
There's Nicola Cottington and Will Pope, Stuart Keeble.
Sorry, you'll appreciate being blind. I can't see your hand. So Susanna's tried to whisper it to me discreetly, but she's being so discreet I can't hear her.
Nicola Cottington.
Nicola Pockington.
Oh, thank you, Chair. I actually put my hand down because Nikki raised the same point that I was going to raise about children and young people.
But it was lovely to hear your voice anyway. Will Pope.
Thank you, John. And I just wanted to also pick up Nikki's point, which is a great one. And just to say, Nikki, I think I've also asked for this very issue to be debated in the next Integrated Care Board development session. Where I was coming from there was, if you like, it's our biggest minority group with no voice in so many ways. And we've got the voice. I'll speak for myself. We've got plenty of old people's voices, but where our young people's voices, and I think this is a really important thing in all parts of our partnership. So thank you for raising the point, and I anticipate we should hear more about this. Thank you. Thanks, Will. Stuart Keeble.
Thank you, Chair. I'm just going to kind of channel my inner Sue Cook now. And I think one of the things we need to do is also, and I know that Susanna's doing this, is to build on the collection of resources that's already been collected with children. Because I think one of the challenges back also is making sure, and the feedback that I've heard from colleagues is you know, who work with children, say, please don't ask me the same question again and again if you're not going to do something about it. So I think it's a balancing act of those of bringing that voice in, but also building on the insight that we've already got. So I think definitely giving a voice is important, but just making sure that it's meaningful and when we do something with it.
Very well said, Stuart. Thank you.
Ruth Bushaway.
Who's next, Susanna?
Ruth Bushaway.
So I can't hear. Did you want to?
Ruth Bushaway.
Ruth Bushaway.
Hello. So yeah, I just wanted to draw on that. We've from the Suffolk GP Federation, we were talking to my colleagues in PPG about resources if we find people in cold houses or children who can't attend appointments, etc. And we're certainly going to try and draw something up to get together as to how we deal with that when we come across that in out of hours, because it's something more likely to happen in that space. So any support on that, I think, would be as a system would be really helpful if we could draw some of those things together. If we find people in cold houses or not, what to do.
Okay, and I think that does come back into the cost of living piece again, doesn't it? So I just find myself all the time saying, let's be joined up. I am aware of about 3 different groups of organisations in Essex seeking to create welcoming, warm places. I think it's so much easier for our residents if they can see one joined up network rather than any sense of competition. Exactly. Really, but your principle, Ruth, absolutely. Andy Jakub.
Thank you, Chair. Just on this subject, really support what Nikki started off as a conversation piece. But before we do reach out to the children and young people, and there are a plethora of organisations across the 2 counties that work with them directly, we need to know what the offer is and what the ask is, because their expectations need to be realistic.
Always the challenge, isn't it, Andy, when you seek to draw on lived experience, that it can raise an expectation that may not be realisable, but it is. I think, Susanna, we're saying children, young people, very important. Let's not rush in with Angels Fair to tread. Let's just think about how we best do that, how we best draw on the information that's available already, and how we make sure that the questions we ask are those that we have the ability to answer.
Absolutely.
Okay. Are there any, I think we've aired that piece very well on the children, young people. Are there any other hands up? No, but thank you for all of that. Thanks, Susanna. And you've got the details of the next meeting on the 11th of November. Clearly, Susanna will be sending out more detailed information in due course. Is it Richard Watson?
Yes, Richard Watson.
So we now come to the one item that we, of major business that we are asked to give approval to, which is around population health management. And I'll bring in Richard Watson in a second. But if I just hark back to that conversation we've just had, we are an all-age integrated care system. And if we are thinking that one of the goals is to work towards a life expectancy which is fairly uniform or standard across our area, and where we see reductions in premature death, which is a measure the Essex Director of Public Health and I are very focused on, so much of that is determined by the time somebody reaches adulthood. And the emphasis on children and young people for me is not just in terms of what they are experiencing, but how we ensure in the way that we work together, we give everyone the chance that they might live a good quality, disability-free or disability-enabling life for the same duration as others. So all the more important. Richard Botson, I'll hand over to you to lead this, but you will, at the end, ladies and gentlemen, be asked to give approval to the strategy.
Thank you, Chair. So I'm really pleased to be bringing today, on behalf of a number of different colleagues, the draft population health management strategy that the Chair's just outlined. I thought it might be just helpful to give a little bit of background. So apologies for some of you who are living and breathing this. But population health management is about using linked data to provide new insight. But it's importantly then taking linked action from that to improve social, physical, mental health outcomes and the well-being of people within and across a defined population that we're looking at, while importantly for us reducing health inequalities through that approach. It's been defined at a national level that there's 4 key elements to PHM: infrastructure, intelligence, interventions, and then the impact. And the strategy talks a little bit about those, so I won't go into detail on that. NHS England has given us some specific requests as part of PHM. And importantly, the one that we've got to do quite quickly is by April 2023, each local ICS needs to have in place the technical capabilities required to use population health management in practice. And I'll touch on that in a second. But also that we do need to have in place an overall strategy, and hence bringing it here today. So within SNE ICS, we've developed the strategy collaboratively, as we always do, which we're bringing today, and it's evolved over time. So we've been working on this on and off for around 6 months or so. We've agreed through the new ICS PHM group to recommend it here today, but it will continue to evolve and develop. So we're not anticipating that it's a finite document and it never changes, a bit like the ICS strategy that Susanna talked about earlier. We will continue to develop this as things shift over time. It's deliberately high level, but sets out definitions, some of the key elements and purposes of PHM. And importantly, we've developed a set of delivery principles that you'll see on page 14 within the pack. We do see the PHM strategy being a key enabler of our overall ICS strategy that, again, Susanna alluded to earlier in her update. But more importantly than that, we do see, as I've already said, it being a key enabler to the work we're doing around health inequalities. So you'll see within it that our PHM strategy starts by noting that to speak up is not everyone's way of being heard. PHM will allow the needs of many more people to be heard, including those facing health inequalities. But more importantly, it's how we then act on what the PHM approach shows us in our work. I'm pleased that we've also made a lot of progress over the last few months in actually starting to turn this into reality with some of the infrastructure that we need to put in place. So we now have a PHM strategic group, which will report both into the ICP and through to the ICB via our performance committee. And we've also got an operational group, which is working with our 3 place-based alliances. And if anyone is interested in hearing more, getting more involved in that, if you drop me a note, I'll put my details in the chat function. Happy to pick up that offline. We've also now procured that longitudinal linked data set. Don't ask me about the technical side. I'm hoping Stuart or a colleague can answer any questions on that side of things if we get onto it. That's not without some challenge, but we have got an operational group, as I alluded to now, looking to mobilise that and get that data set now into place. We've also agreed through the ICB recent board meeting additional capacity for both the analytical element lead and 3 alliance posts, plus we're going out for a clinical and professional lead in each of our 3 alliances. Also importantly, we're making sure that we're sharing our PHM strategy with our neighbouring ICSs, because clearly there's overlap, particularly into the Norfolk and Waveney and into the Essex system, particularly Mid and South and Herts and West Essex. And to support that, NHS England has pulled together a regional PHM group that we're represented on through myself, Anna Crisp and others. And that will ensure that we are joining up where needed, particularly on those border areas where we're working on PHM together. So I just wanted to say, finally, a huge thank you to the wider PHM team who's been developing the strategy and indeed turning that into action. And I'm sure, like an Oscar speech, I'll forget someone, so apologies, but just a few names: Anna Crisp, Helena Joplin, Mark Shenton, Julie Irving, Catherine Pearson, and Andrew Kelsey, who's jointly sponsoring this paper today. So at that point, if that's okay, Chair, I'll pause and happy to open the conversation now.
Yeah, well, thank you, Richard, and thanks to everyone that's been involved in the developments of this. This is a big item, and we are being asked to give approval. So could I invite questions and comments? And Suzanne's going to shout out the names for me.
Okay, so Nikki O'Shaughnessy.
Nikki again.
Thank you. Thank you, Richard. I can see a huge amount of work has gone into this strategy. But I wanted to raise a point about the language that's used in it, because the strategy talks about individuals, and obviously individuals live in families or are part of families who live in communities. And I was just concerned that if we use the word individuals, we might lose that opportunity to see the wider family system. I also thought that would bring a warmer touch to the strategy as well, in terms of the language that we use, and make it more friendly and appealing. But it really does talk about the context of what we do. And I did like Maslow's hierarchy of need being in there as well. But I think for me, it was about the context of just using terminology around individuals and then communities, because I think we miss a whole opportunity in terms of families and friendliness and a warmer approach in this strategy. Thank you.
Thank you. Thank you, Nikki. I'll bring you back in a minute, Richard. We'll see what other points people want to raise. Other comments?
Judy Newman.
Peter Newman?
Judy Newman. Sorry.
Yes, thank you. And thank you, Richard. This is really welcome. And it was so many of us that are really excited to see the development of this programme. And I suppose one thing, so sorry, I'm Judy Newman from St Elizabeth Hospice, for those of you that haven't met. So from an organisational point of view, I'm really interested in PMH readiness and what we can do now that will get us in a stronger position for when we start to plug into it, because there's an enormous amount of enthusiasm and we can absolutely see the value and the benefit, but we don't want to be caught on the back foot. And so really, if there's anything that we can be doing as organisations in readiness for this, I suppose that's what we'd like to do, so that we can make most of the potential.
Thanks, Judy, and apologies for momentarily making you Peter, but that was a very good point. And thank you for just saying where you're from. I think sometimes it will be useful for us not to assume that everybody knows where we're from. Leighton Hammett.
Thank you, Chair. So, Richard, a really positive strategy. I suppose my question is there any further thoughts around onboarding other organisations, for instance, for Essex Police, Suffolk Police and other organisations that will have data that will help kind of inform and deliver that strategy from a public health approach? Because there's a lot of talk about sharing data that I'm really supportive of, and this could be a good vehicle to utilise that, especially if you're going to have dedicated analytical support. It's quite an exciting proposition from a policing point of view to join up, if it's something you'd be willing to consider.
Thank you, Leighton, and thanks for all the contributions you're making and across the ICS networks. Ganesh Valayo.
Thank you, Chair. Thanks, Richard. It's a great paper. I've not had a chance to fully absorb it. I received it yesterday, but I'm not embarrassed to keep banging that EDI drum. So it's good to see that there's the considerations there. You talk about, obviously, the case for change. I think the last question around creating the conditions for change, it's not always clear that we're supporting that climate for change there as well. So that does need to be something considered and transparent.
These are very good points. Thank you. Richard, but shall I come back to you? I know there's more hands up, but you've got about 4 points to answer there, Richard.
No problem. That's fine. So in terms of the first point, I think really well made about the individual versus family or communities. And I think will really help. We'll reflect on that in the language and the terminology. So I'll pick that back up with the team. I think we can ameliorate that, Nikki, and soften it, as you just said. So really well put. Judy, what more can we do? Open invite, I think, as I said earlier, if you want to join the strategic group around this, it's an open forum, so you're very welcome to come along. So I'll pick up with that with you separately. I also think I might ask Mark, I know he's got his hand up anyway, just to reflect on the work that's happening in Ipswich and East Suffolk, which clearly, Judy, is where you're based, because there's already lots happening practically in using the PHM approach. So just to tee up Mark in a second on that. Leighton, absolutely, on the police data, I'll link you to Alex Royan, who's our data and analytical guru. We would really like both VCSE data and police data flowing into that. I'm just cautious about running before we can walk, but I think we've definitely got an ambition to to kind of link everything we can possibly get through. So I'll link you through to Alex. And then Ganesh, yes, I think part of the team that we're trying to wrap around this will be about also that trying to influence the climate of change. So being ambassadors and proponents of the approach, but also listening to communities and others about how we can utilise PHM to best effect. So once we've got that key post in place, I see that you would be really good contact, Ganesh, to talk with your ICB role with them around how we might do that. So I think, Chair, that's the first 4 questions.
Thank you, Richard. Let me then come. Mark, you've been very well trained. Mark Shenton.
Thank you. I just wanted to say, Leighton, in Suffolk, I know that the Suffolk Office of Data Analytics does have close links with the police and includes data from the police in their data sets, and there is certainly the ambition of bringing that all together at the appropriate point. I just wanted to build on the fact that what you've seen today through the strategy, there's a lot of focus on data, but actually when it comes to the methodology, this is really about how we change what we do and how we get different outcomes, better outcomes from changing what we do. So how we use this will define whether this strategy is the purpose of it, the purpose of what we do, that common purpose of making lives better, will be dependent on us, all of us, to take through our teams, not just what will the PHM group do. So, if we're going to realise the benefits of this is how we change the culture of what we do, what we role model to our teams, and what we can do to help support them, not just theorise about what we could do, but what we will do, and how we will do it more inclusively, more collaboratively, and do that in real work, not just in theory. And Judy, we're going to be embarking through the One Team programme in Ipswich and East with a PHM approach to projects, because I think unless we give people the time to think differently, we won't get people measuring differently and doing differently. So I think it's really beholden on us all to think, how can we support that endeavour? Thank you.
No, thanks, Mark. There was a lot there. Thank you. Stuart Keeble.
Thank you, Chair. I'm Stuart Keeble, Director of Public Health in Suffolk. I think actually Mark's picked up on a few of the points I was going to make, but I think on that piece, I think about seeing PHM is almost a building block and a roadmap. So as Mark alluded to, SODA, Suffolk Office of Data Analytics, has been looking at bringing together data from a number of partners, and also ECTA in a similar way of doing that. So actually, we've got different parts of the building blocks coming together. So some of these things have already been in place and have been tested over COVID. And then it's a question then about how we then bring that together more with the health data. And so it's kind of bringing those things together. And I think just emphasising on Mark's point about the culture, I think, this mustn't be seen as a data exercise. This is not a data exercise. This is something far more that needs to permeate across from supporting and enabling frontline staff, and some of the work that's already been demonstrated is some of the PCNs and INTs within Suffolk and North East Essex, but also from a more strategic decision maker. It needs to permeate through there and be a key tool to both enable, challenge and support, but then also about how we link it as well to not losing the voice of our residents in that as well. It needs to come together to do that all together.
Thank you very much, Stuart. Tanya Farrell.
Hi, I'd just like to reflect on the comments that Stuart and Mark have just made, and just actually try and start thinking about primary care as being more than just GP practices. I think we mentioned primary care quite a lot in that document, and then we actually put in place enablers that are actually quite GP practice specific. I know obviously there'll be an implementation plan on, underpinning this strategy, but I just think as a system, we need to start thinking about that wider engagement with primary care and the additional pillars of primary care, because I really think community pharmacy's got a huge place in delivering services within communities that, you know, would be supported by this strategy.
Tanya, I didn't know where you were from. Susanna's just told me you're from the Pharmaceutical Committee and you've used the pharmacy word at the end. I wholeheartedly agree that we should be thinking all the time about community at the primary care end across GPs, pharmacies, and what I might call the informal community voluntary sector as well. Community-based solutions, I'm going to say it, Nick Hume, enable us to move to the vision of hospital as a last resort. And if one point of the system's under huge pressure, let's make sure we're using it all. But Richard, I was very naughty there and gave a view from me. Richard, over to you.
I wouldn't dream to disagree, Chair. But in terms of a practical, Tanya, I know when Andrew and I came to see you in the committee a couple of months ago, we were keen absolutely to bring you more in the fold around this and other areas of work, particularly given the commissioning responsibility is moving back to us from April. And we are looking to potentially set up, particularly for SNEA, a pharmacy task force along the same lines as we're doing now for dental. And I think that's a really good opportunity to up the profile of the work that yourselves and your Oppo teams in Essex are doing. But also there's an open invite, as I said, to all. If you would like to also engage with the PHM strategy group, we can get you into that as well.
Thank you very much. I know Will Pope's hands up. Are there any other comments before I come to Will?
No hands raised, Chair.
Okay, so Will, I'll hand over to you for the last word before I seek approval, conditional approval from the ICP. Will?
Yes, thank you, John. And Richard, as you know, I'm very supportive of this. So don't take in any way what I'm saying now to have any negative implication. It doesn't at all. But I wonder if you'd like to say, for the benefit of the ICP members today, would you like to say a few words around implementation and use of knowledge for delivery and impact, and how we'll measure and evidence impact, and perhaps something on frequency of review? Would you like to sort of comment on those points?
Yeah, and I might also invite Stuart and Mark, if Chair, if that's okay, as two people have been heavily involved in this. So I think, as Mark alluded, we're already using PHM in all three of our alliances. So it's not that, you know, we're kind of strategy and then get into it. There's already work happening. What we're trying to do through this is kind of have a more systematized approach now across the ICS with the strategy, with the one data set that's linked. And we're also putting money behind it in terms of some of the capacity and resource to augment what effectively has been an add-on to people's jobs in a great way, but we've recognised that we need more capacity to enable this to happen. I think it's just important just to quickly reference the intelligence function that we're also looking to put into place across the system, which effectively would be bringing business informatics and support, health economists, evaluation support together. And can't say too much at this point, but I might come back to the ICP next time, because we're out to procurement at the moment about one organisation with a local system hosting the hub. The reason I say that is I think that intelligence function and PHM are inextricably linked, and it will help drive particularly the evaluation part, which, if I'm really honest, my personal views, I don't think we're particularly good at evaluating our interventions, not just PHM, more broadly than that, and then acting on them. In terms of when do we come back with actually seeing the results of some of this, I know we've agreed, Will, at the ICB board 6 months. It might well be that the ICP wants an update on where we're at with this in 4 to 6 months' time. As I alluded to, we are looking at that strategic group being anchored into the ICP. I know Susanna was still working through the finer detail of the governance arrangements, not just for this, but there are other things. But there's definitely, I'm seeing PHM as a direct route in that's appropriate into the ICP. So I think between 4 and 6 months, if the chairs agree, might be helpful to come back and actually turning this more into a reality conversation rather than just the architecture and the infrastructure.
Well, I think that's at the exact timing we can sort out according to the pressure for other needs, and when you know you're ready, actually, Richard, if you're with me.
That's fine.
It's quite hard to say now, will you be absolutely ready in 4 months or in 6, if you see what I mean. The concept, though, and that we do it in maybe in a workshop mode as the informal part of a meeting, Susanna, because I'm much struck by the engagement that's been this morning on this topic, and exactly what you said, Will, about anyone can write a strategy paper, few can implement brilliantly.
2 more hands.
Right, so we've got some more hands. Who have we not heard from so far?
Well, 2 more hands from Mark Shenton and then Stuart Keeble.
Is there anybody we've not heard from before I bring you gentlemen in? No. Okay, Mark, then Stuart.
Yeah, it was just the invitation to come back on following Richard. So in terms of evaluation, we've got an opportunity to start practicing the OBA, the outcome-based accountability methodology, which is all about evaluation, but it also invites the co-production at an early opportunity when we're starting to look at the intervention end of the PHM. And just to say, and hopefully reassure Tanya, that the development, the practical development of PHM was originally conceived around primary care networks from a national direction, which is why it might appear that it's more focused on general practice, but we are definitely taking it through integrated neighbourhood team development work, which of course includes everybody. Thanks.
Stuart.
Thank you. I think just building on the final point that's been made is around that sharing what is already going on. So Susanna has already organised a Thinking Differently event around PHM and some of the lessons and learning. It might be, Susanna, it'd be good to send the link out to that, because I think, again, so people this isn't theoretical, this is practical. And I think, and if we can keep feeding those through as we grow and develop, that will also help us as a system to get our head around some of it as well.
Susanna?
So yes, very good point. We've actually held 2 Thinking Differently Together events around population health management. They were extremely popular, and what was great was the sharing of case studies and examples of PHM in practice. So both are online reports, and I'll ask my team if they could drop into the chat the links to those reports, which are online on the website, so you can have access to them now. Thank you.
Thank you. So members of the Integrated Care Partnership, we're asked to give approval to the strategy. Richard, I think what I've heard here is some very good suggestions, quite a few to do with language, the humanity of the language, the inclusiveness of the language, both in terms of individuals and parts of the system like pharmacies. A request in 1 or 2 cases from Ganesh for a strengthening. But I haven't heard any issues of major substance of disagreement. So on that basis, I'm going to ask if members of the partnership will agree to approve the strategy, subject to those points being taken on board.
Will Pope has his hand up.
Will?
Yes, I'm not
objecting.
No, I'm not going to object, John, but I noticed that Peter has put a couple of very useful comments, well, indeed, Andy, actually, as well, a couple of very useful comments in the chat, and I wonder if it might be helpful if Peter and Andy just verbally make those points. I think that might be helpful.
Well, thank you. Can I just share with you, we're going on to have a discussion about diversity. I've told you I'm blind. Use the chat for items of process, but if you have substance, it is quite discriminatory to use the chat. And I'm sorry, I'm not giving you a discipline interview, guys. It's gentle coaching, take it as, all right? Peter, I don't know which Peter it is.
Peter Smythe.
Peter Smythe.
Yeah, apologies, Chair. My camera's not working, so I don't know quite right. I'm having a childcare nightmare, so it's not a good morning. But on the second point, I think we just need to reflect that this will unmask quite a lot of unmet need amongst the population, and it is absolutely the right thing to do. But the rhetoric needs to be around prioritisation. Rather than there's a whole bunch of extra stuff that we need teams to do. And as long as we're signed up to that, I think that's quite helpful.
I think that's a very fair point, Peter. Thank you. And a good point of substance. And now there's an Andy, I'm told. Andy who?
Andy Yakub.
Andy Yakub.
Hello, Chair. My message was directly to Richard Watson. That's why I put it into chat.
Do you want to share it, though, or is it just a process point?
No, it was a response to Richard's point around the weakness in not necessarily evaluating. And I was making a suggestion that both Local Health Watch are an independent resource for such, as are the two universities on our patch and several voluntary community sector organisations that have evaluation or research surveying capabilities.
Absolutely right. I think Mark Shenton's hand's come back up.
Yeah, it was just in response to Peter's points, and I hope we've got that covered in the principles around how if you create work through the PHM process, you need to be taking responsibility for how it is then taken on and implemented, which would include the prioritisation. So hopefully, Peter, that gives a little bit of assurance around responsibility and responsible use. Thank you.
Yeah.
Okay. Thanks very much, Mark. So I'll try again. We're asked, ladies and gentlemen, to give approval to the population health management strategy subject to those tweaks and inclusivity of language to which we've referred. Are there any of you who, well, I think we should ask for hands up. This is an approval item. So those who are able to physically or with technology, raise your hands, please do so, if you agree.
Lots of hands up.
Okay, thank you. Susanna's seen crowds of hands. Are there any of you who are against? So that is approved. Thank you very much. Susanna, being greedy, wants another word about the next meeting.
Okay, so thank you, Chair. So attached to the papers, you'll see there is a little kind of flyer, if you like, electronically for that next meeting, which will take place as part of this Community Connect event in the Food Museum at the Stowmarket. What I need you to do as members of the ICP who will be attending on that day is I just need you to log on the Eventbrite that you're going to be present. That lets our venue know how many people we're going to have on site. So it's really quick to do. You'll see that there's a web address on our website. You can also get to it again from our homepage. And if you just scroll down the page, there's a great big red button. Just hit the red button, put in your name and your title, and we've got you recorded. That just helps us keep track. The last time we did this was for Expo. And I remember on the morning of Expo, we had another 150 people registered between when I woke up and halfway through the morning. So it is just really helpful because it does help our venue. It's a community venue, but it just helps them to know how many people to expect for things like catering and so on as well. And the other thing is please do share the opportunity to attend that event. The purpose of these Community Connect events is so that there's an opportunity to learn for learning between our place-based alliances. We've got excellent work going on in Ipswich and East Suffolk, and they're going to be sharing some fantastic examples of what they do. We'll obviously be circulating an agenda for the presentation part of that day, but also there is room at the venue, as we did at Expo, for stalls, for exhibits. We can accommodate some inside and outside activities. So if you've got things that you'd like to contribute, please let us know. We'll try and fit you in. It's a big site and we're hoping it's not going to rain that day, but you never know. So yeah, hit the red button halfway down the page if you wouldn't mind.
So this is just if you want to come to the Integrated Care Partnership meeting. So
the meeting will be like at Expo. It would be in.
So we're not having a meeting of the partnership on it. So.
There's an event going on, and in one space during the day, in the morning, the meeting of the ICP will take place. So when you turn up, there'll be, as it was at Expo, there'll be some stalls, there'll be other people on site.
But we're trying to have a workshop about strategy. That's where I'm struggling.
Yeah, we're going to have a workshop of strategy in a separate room at the event. Yeah, there's different spaces like there was at Newmarket.
I would recommend that you, despite your strong coaching there to people, you'll probably need to send another electronic reminder to log on later.
Absolutely. Thank you.
Thank you. I have not been given any notice of any other business. Is there any other business of an urgent nature?
No hands up, Chair.
I wonder if we have any members of the public on live stream who would like to ask a question.
There's no questions online.
Nothing. So, ladies and gentlemen, that concludes this this formal part of the meeting. We will be resuming at 11:15 when we move on to these two important items of equality and diversity and cost of living. So, Will, who will be taking the chair, I know will look forward to as many people as possible rejoining at that time. But can I thank you all very much for your participation. Everyone who raised hands, thank you. And we wish you a very